Let's begin with the latest announcement. Now, the country has recorded 12 new cases of coronavirus, bringing the national tally to 246. According to the Health Cabinet Secretary Mutahi Kagwe, the new cases were confirmed cases as a result of more than 400 samples tested in the last 24 hours. CS Kagwe, who spoke at the Jomo Kenyatta International Airport earlier this morning, said there was a possibility that the numbers could be higher by the close of business today. CS Kagwe said out of the new cases, 5 were hotel staff, while 4 came from contact tracing.
This is a unique and outstanding performance. We were getting desperate for some of the items that are on this flight, and we are glad to see that the cooperation across all government agencies is what is going to help us in winning this war against this deadly epidemic. Just for the record, on this flight, we have been informed that we have got 500,000 3-ply masks. We have got 200,000 testing and sampling tubes, and this is a very important thing. These 200,000 sampling tubes are key to our ability to mass test Kenyans. Without these sampling tubes, we would not be able, and we were not going to be able to start our mass testing capability. But with these tubes now, we are able to fast track. We also have some 4,000 shoe covers for operations with our frontline health workers, 300 static shoes which are used in theaters by our doctors. We have got 76,000 N95. This is this kind of mask, N95 face masks, and we also have face visors by those that are used by doctors. In the next flight, there will be additional ventilators and so on and so forth. So all I'm saying is that we are really grateful that Kenya Airways has been able to come on board and assist us to the extent that they have. We have developed protocols with them on how to travel, on how to quarantine themselves, the crew, when they come and when they go, they know what to do. So we are happy about what is happening. And this is because, as you know, normally I would make this announcement sometime at about 3 o'clock, by when we have got all the samples. But today, because of this particular conference, we will not be having another conference. But as we stand right now, at this hour, we have already tested about 450 samples. Out of these 450 samples, we have already got 12 positive cases, and we have not finished the day. And 5, for example, are hotel workers, and another 4 from our sampling, from our contact tracing capability. What this tells you is that we need to really start the testing capacity, so that the contacts of those people who are positive can also be tested, and therefore we can be able to maintain and contain the epidemic.